Just going to give you some basic knowledge and some basic facts about shoulder problems. I am an orthopedic surgeon with specific training in shoulder and elbow problems, so that is my area of interest, and I hope to pass on some information which might be of use to you in day-to-day life. And I will be speaking in both English and Gujarati for ease of understanding. So the shoulder joint is, like Praveen Bhai previously said, after common cold, back pain is the commonest general symptoms, and shoulder joint probably ranks just after back pain as the next common orthopedic problem. Knee joint, shoulder joint, both are extremely common problems to have, and there are statistics that 1 in 4 person will suffer from shoulder pain in their lifetime. So that's quite a profound number, and therefore it is a major cause of disability and work absence also. And I'll explain to you why. Because of paucity of time, I won't be able to go into details of everything, but these are the commonest conditions that I see in my clinical practice. And even amongst these, the time will probably only allow me to look at and discuss these couple of situations which are by far the commonest even among shoulder problems. Frozen shoulder is probably a term everyone is familiar, yes? Anyone has not heard of frozen shoulder? Okay, so probably I can explain a bit to you about what frozen shoulder is. And the tragedy is that sometimes it gets mislabeled. It's like koi bhi dukhav hoy, that gets labeled as a frozen shoulder. But actually it's a specific term and a specific findings hoy, and I'll just show you what exactly frozen shoulder is. So in simple terms, frozen shoulder when your joint stops moving, it's frozen. Now it may be frozen because of pain also, or it may be frozen structurally, and explain what I mean. It's generally shoulder is a ball and socket joint. એટલે આપણે કહીયા ball હોય ખભામાં, એ ball it allows us to do all the movements. To keep the ball in place, Kudrat has given us a covering which is called capsule in medical term. એટલે એની જે પરત હોય એને capsule કહેવાય. એ પરત is very elastic. આમ ફૂગો તમે જુઓ તો ફૂંક મારો એટલે ફૂગો બોલી જાય. It is that elastic. It's less than a millimeter, half a millimeter thick. એટલે that elasticity allows shoulder to be the most mobile joint in the body. એટલે આપણે બધા function કરી શકીએ. But just imagine if this elastic was replaced by this tire tube. Would we be able to just puff the air in a tire tube? આપણે ફૂંક મારીને હવા ના પૂરી શકીએ. For that you need a pump, right? So this is just an example I am giving કે આપણી જે કુદરતી પરત હોય which is so elastic and so thin, it because of pathology એટલે બીમારીના લીધે એ આમાં કન્વર્ટ થઈ જાય into this sort of picture. એટલે આપણો shoulder naturally beyond the point, it does not allow the elasticity to move beyond the point. એટલે જકડી જાય, and that is called a frozen shoulder. So just to elaborate further, this thing is like elasticity એટલે loose હોય આપણું capsule. જ્યારે આપણે મૂવ કરીએ તો નીચેની બાજુ ટાઈટ થઈ જાય, ઉપરથી લૂઝ થઈ જાય, and that allows the shoulder to move in all directions. But what happens if this thin layer becomes thick at the bottom? એ જાડી થઈ જાય એટલે હાથ આટલો ઊંચો કરીએ એટલે નીચેથી પકડી જાય. So it will not allow the ball to move freely throughout the range, because beyond a point that layer will pull it back. Okay, so this is what is frozen shoulder pathology. I tried to explain in simple terms. So, what is frozen shoulder? These are the predisposing factors. Okay. So, the commonest predisposing factor is diabetes. So, 1 in 3 diabetic will get a frozen shoulder in their lifetime. And it doesn't have to be insulin or non-insulin dependent, any diabetic, and it doesn't matter whether it's controlled or not. So, we still don't know why that is the case, but it is well proven that diabetics, sometimes there are people who come to me with frozen shoulder and get diagnosed as diabetics. એમને ખબર જ ના હોય કે diabetic છે. But it is so common, I get everyone checked for their sugar levels if they come with a frozen shoulder. So the next thing is hypothyroidism, and after stroke, ઘણા લોકોને stroke થાય, stroke માંથી recovery થતી હોય છે. After 3-4 months they suddenly start getting shoulder pain and stiffness, and it's a frozen shoulder which actually frequently gets missed because everybody is focused on the stroke part of it. It is more common in middle-aged females. એટલે 40 થી 60 ની વચ્ચેની females, they are usually more prone to get it. So these are some salient facts about frozen shoulder. But this is the important part. 50% લોકોને કોઈ હિસ્ટ્રી જ ના હોય, આ બધામાંથી કશું જ ના હોય, they can still get frozen shoulder. So like I said in the first slide, 1 in 4 persons may end up getting it in their lifetime. Okay, and this is how it looks like. This is an old arthroscopic picture from one of my patients, 2015. So the joint is very angry looking. This is how it looks. एकदम red होय, अंदर के inflamed होय, and that is why it's generating pain, right? And classically there are 3 stages described for frozen shoulder. પહેલી stage होय 4 થી 6 મહિના ચાલે, which is called a freezing stage. એટલે એમાં સખત દુખાવો થાય. Any movement is painful, and you know it's generally not a happy time. Painkillers સતત ખાવી પડે. But after that period, the pain will settle down. અને the stiffness keeps on increasing. એટલે for the next 1 year or so, the shoulder will become increasingly stiff. And the thawing phase is when ice thaw થાય, એટલે melt થાય. It's called a thawing phase. કે ભાઈ અમુક ટાઈમ નીકળી ગયો પછી naturally this shoulder will start to ease up, but it almost never comes back to normal, and that is important to know. That in a true frozen shoulder, sometimes you can end deficit of about 10 to 20% of movement, although it is not noticeable. So these are the 3 phases, the natural history, and it's important because that's how the treatment is determined. So it's a clinical diagnosis. The important thing is passive movement. Passive એટલે આપણે આ કરી આને એક્ટિવ કહેવાય. મેં જાતે કર્યું મૂછું. Passive એટલે કોઈ સપોર્ટ સાથે કરે તેને passive કહેવાય. Now if I am able to do this by myself, it's not frozen. No matter what the MRI says, no matter what the doctor says. If I am able to do this up to here, but somebody else can get it up, then also it's not frozen. If I can get it up to here and even the doctor doesn't get it above this, then it is a frozen shoulder. In simple terms. Okay. X-rays is usually all that is needed. MRI is unnecessary most of the time, although it will prove it's a frozen shoulder. But ખાલી classic clinical findings હોય તો ઘણીવાર કોઈ expensive investigation की જરૂર હોતી નથી. What about the treatment? First thing is, how do we avoid? Unfortunately, there is no magic pill or any exercise that I can suggest to avoid. But yes, of course, જે predisposing factors છે, diabetes is a major contributing factor. So diabetes ના જે risk factor આપણે avoid કરીએ કે આપણને diabetes ના થાય, that in itself will put you at a lesser risk of getting a frozen shoulder. Lifestyle modification, like my previous speaker said, it is the key. We all live a very sedentary lifestyle. In your daily exercise routine, if you incorporate some exercises of shoulder stretching, the thing is, in our day-to-day activities, આપણે આ કોઈ movement કરવાની બહુ જરૂર પડતી નથી, right? So what we do is, most of our work is limited below this range, and that is part of the reason why many patients can actually live with frozen shoulder throughout that cycle and not need very intense treatment. But જો તમે regular stretching ની ટેવ પાડી દો in all directions, then that will also to some extent prevent you against frozen shoulder. And the last part is important. Historically, in orthopedics, we tend to immobilize any joint we operate. Fracture થયું હોય કે tendon repair કર્યું હોય કે કંઈ બી કર્યું હોય કે તમને ખાલી વાગ્યું હોય તો બી આપણે જોડી મારી દઈએ અને મહિના માટે ભૂલી જઈએ. And if you don't do any activity for that month, you just leave it in a sling, then there is a very high chance you may end up with a frozen shoulder later on. So it's important to keep doing some exercises, whatever your doctor will allow, depending on the type of injury. Coming to treatment, initial phase is inflammation phase, like that picture I showed. So mostly some painkillers, anti-inflammatories. Steroid injections are useful, but like Saurabh bhai said, repeated steroid injections are not recommended. In fact, they may be harmful. So there is no such thing as a course of injections. ઘણા પેશન્ટ તો મને આવે કે મેં તો 6 ઇન્જેક્શનનો કોર્સ કર્યો, મેં તો 9 ઇન્જેક્શનનો કોર્સ કર્યો. There is no such thing as a course. Steroid injection is meant to be a very short-term analgesic effect, anti-inflammatory effect. Any asset 1.5-2 મહિના ચાલે. જરૂર પડે તો maybe it can be repeated after a few months, but not regularly. Instead, what I do, and I just explained in the subsequent slide, is a process called hydrodistension. So if the exercise part doesn't work, and this is the sheet I provide to all my patients, of frozen shoulder, which has information about the frozen shoulder and it has all the pictures of the exercises they need to do. So hydrodilatation, if you remember the pathology I showed, કે આમાં જે capsule છે ચોંટી જાય છે, this process is reversing that. It is extremely successful in the first 6 months. If somebody comes to me, there is more than 85% cure rates for them. And hydrodilatation, we just use an injection. Most of the time, it's in local anesthesia, and patients regain 50% of pain improvement and movements within, like, in a day or two after the procedure. So this is how we do it. We localize the joint. Sometimes I have to put a dye in the joint to confirm that I am in the joint. And this is the important aspect of the procedure, is what you see here. Just observe what is going on. So I'm putting the medicine in and the joint is pushing it out. It is so tight. હું દવા નાખું છું અને બહાર કાઢે છે. But I keep doing this procedure till I strip the capsule. And this is a key part of the procedure. હું સ્ટેરોઇડ નાખીને ભૂલી નથી જતો. There are a cocktail of medicines which we use. But the important part is the mechanical aspect of the procedure, which puts the joint, the capsule away from the bone, and this is what helps get the movements back. So if you observe this picture, this is when we started the procedure, and this is towards the end, and look at these distances. So we can objectively see that the joint is opening up. This is another X-ray image. This is when the procedure was started. This needle is in the joint. And just look at how much the joint has opened up. Can everyone see that? So this is what physically reversing the effect of the capsulitis. So just to briefly again go back to that picture which I showed, a normal steroid injection, what it does is this red capsule is the inflamed capsule, and then thoda time mate the pain will go away, but eventually when the pain comes back, you are back to square one. Hydrodistension, this layer is actually physically stretched out, which helps us regain the movement. Right? So this is in the initial phase only, it won't work in the later phases. So in the later phases, the only option is either you wait it out, કે ભઈ આની દોઢ બે વર્ષની સાયકલ હોય છે, એના પછી દુખાવો બધું જતું રહેશે, or you go for arthroscopic surgery, and this is how it's done. Just a couple of minutes about the next common condition, which is the rotator cuff tear. So this is supraspinatus tendon. I will not go into the detail of what is rotator cuff. It will be too technical for you. But this helps our arm move up, this tendon. Okay. Now this is a very robust tendon, but with age it becomes weaker. And a minor trauma. Kiran bin aaj wo mazak karta tha, when we were just climbing up, and he was carrying these heavy books in 2 stacks, and he was just carrying it up. And this is a very common mechanism of injury. We forget that the tendons may not be as strong. આપણે 15-20 કિલોનું ઉંચકી લઈએ, ક્યાંક suitcase ઉંચકી લઈએ, whatever, but that minor trauma, because the joint, the tendon may not take that stress, and it can result in rotator cuff tear. So it's a common condition in patients, in people over 55 years of age. There may or may not be a history of injury. X-ray being normal is the commonest misconception. આપણે ક્યારેક વાગ્યું હોય, X-ray પડી અઠવાડિયા પછી, X-ray is normal, so we forget about the injury. But if it does not improve after 15 days, please go to your orthopedic surgeon. You may need an MRI scan to confirm this injury, and this is how it looks on the scan. So just 2 minutes, then I'll finish. 1 minute. So why have I put this picture? In our mind, we are still this guy. આપણા મગજમાં તો આપણે બધા પાકિસ્તાન છીએ. We have not grown old at all. And what happens is the tissue degeneration, the bone weakness, everything we forget. અને આપણે જ્યારે રોટરીનો ક્રિકેટ ટુર્નામેન્ટ આવે વર્ષે એકવાર, ત્યારે આપણે ઘરધડા ફાસ્ટ બોલિંગ નાખીએ, કારણ કે આપણે મગજમાં તો આપણે હજી બધું ફર્સ્ટ ક્લાસ જ ચાલે છે. But that one bout of overactivity can result in, and it's a very common mechanism of tendon damage in the knee as well as in the shoulder. So we have to respect our age. That's the point I wanted to get across. We get these New Year resolutions. We'll start gym. We'll start pumping iron after 20 years of inactivity, and inevitably it will result in some or the other tendon injury. So we have to respect our age. Of course, we need to increase activity, but we have to increase it gradually and within reason. So done that. I won't go into the details of treatment. I had some more slides, but I'm running out of time. I'll just show these two videos and I'll finish off. So, this patient had a rotator cuff tear for last 4 years. This is an old video, maybe 5-6 years old, and you can see he's barely able to lift his arm. His injury was extremely bad. There was no tendon left there on the shoulder, but he underwent this repair, and this is him after 6 months. Okay. So the common misconceptions about treatment that I am too old. I operated on a lady who was 78-year-old last week for a rotator cuff repair. If it needs a repair and if you are physically fit to get surgery, then get it done, because this thing does not heal on its own and it will only get worse as we grow older. Thank you very much.